Hello, my name is Ian McCall, and this is another of the consultations in dermatology from the Australian Institute of Dermatology. Today we're going to look at a condition that presents often as multiple pink nodules of the skin. And this is a condition called neurofibromatosis. Now, this is one of the commonest autosomal dominant neurocutaneous syndromes you're going to see. And note I've said there's two types, neurofibromatosis type 1 and type 2. And there are some differences between them. This is the classic type 1 neurofibromatosis with multiple neurofibromas, but they're often not there at birth. At birth, you tend to get lesions called cafe-au-lait spots. And usually, in type 1 neurofibromatosis, there are 6 or more of these. It may be perhaps 4 months before they will all in fact show, and obviously the size of them that's significant varies a bit depending on the age of the child. Generally, in an adult, the cafe-au-lait spots have to be more than about 1.5 centimeters, whereas in a child they can be 5 millimeters. The important thing, though I've said it's an autosomal dominant disorder, up to 50% of the cases of type 1 neurofibromatosis are in fact new mutations. In other words, there's no family history. Usually in autosomal dominant disorders, one or other of the parents have them and half the offspring may get it. But in this condition, 50% are in fact new mutations. The other feature that you go looking for in type 1 neurofibromatosis is axillary freckling. Now, axillary freckling, it develops in about 70% of type 1 neurofibromatosis patients. And it's usually in middle childhood that you'll see it, so it may not be there at birth. The freckling isn't just in axilla, it can be in the inguinal folds as well. The classic neurofibromas themselves, they start usually around puberty or slightly before that, but they just steadily increase in number throughout early adult and later adult life. Let's go and look at these now in the image format. Okay. Look at the differences in the sizes of these lesions. There's another type of neurofibroma called a plexiform neurofibroma, and it's one that tends to be flatter and is seen with folds. And I think there's a little example here in this particular journal, the Dermatology Online journal. You can see this is a plexiform neurofibroma occurring in folds. Now, another characteristic feature of these neurofibromas is that they show a buttonhole sign. That means that when you press them, the lesion appears to go down through a little defect in the underlying skin, in the dermis, and almost appears to disappear into this. So it's a very characteristic feature, this buttonhole sign of some neurofibromas. Here's another picture of the anterior chest wall. Here again you can see the marked variation in size of these, but they're usually pink and they're certainly multiple. This is an example of a lady who in fact had rather large cafe-au-lait spots. And she certainly had 6 or more. She had some other areas of pigmentation here, but she didn't have a lot in the way of neurofibromas, even in her late teens. The other feature that one should look for is a feature in the eyes called Bleach Nodules. Let's see if I can show you a picture of those. This is a leash nodule. These little hamartomatous developments on the iris of the eye. Often you need, in fact, a slit lamp to see them, although you can sometimes see them with an ophthalmoscope held up close to the eye. But these are the small iris hamartomas that are called leash nodules. And I think in type 1 neurofibromatosis, more than 90% of patients will develop these by the second decade of life. So, we've looked at the cafe au lait spots. This was an example of the axillary freckling, or crow's sign. There's a cafe au lait spot there as well, but with multiple freckles in the axillae. Here's another lady that later on in life has developed multiple neurofibromas. They're not as exophytic, these ones. Some obviously are, but some look like dermal nevi, where they're sunken into the skin a bit. Another example with much fewer of these lesions, still pink, and again almost sessile, sitting on the skin surface here. They may still show that buttonhole sign with a bit of pressure. If you look at the histopathology of neurofibromas, you can see the overlying epidermis is generally normal, as is the papillary dermis, and most of the lesion is down here in the reticular dermis. And if you look closely, you'll see multiple spindle cells in the stroma, pinkish stroma, and you can see the spindle-shaped nature of many of these cells. And this is a very typical picture of a neurofibroma. There are special stains you can do, like an S100 stain, to show these up, but generally pathologists don't require that. You can get a solitary neurofibroma. Now, obviously, this patient doesn't have multiple cafe au lait spots, doesn't have axillary freckling, and may only have one of these lesions that you biopsy, find it's a neurofibroma. That person doesn't have, the inherited type of neurofibromatosis. And there are a variety of, well, let's look at this one. This person does have the hereditary type of neurofibromatosis. And there are various other disorders that can be associated with this in type 1 neurofibromatosis. And those disorders, can be epilepsy and certainly learning difficulties in early life, though they're often mild. These neurofibromas may develop not only in the skin, but can also develop in bone or the gastrointestinal tract. And you can get them in the spinal cord and get spinal neurofibromas as well, or in the CNS. And rarely, one of these can develop into a sarcoma, a malignant neurofibroma. But the one that's most likely to do this is that plexiform one that I showed before, the one that sort of presents almost as folds in the skin. The other abnormality they can have is a condition called Pheochromocytoma. Now, this is an amine-related tumor that gives rise to flushing and gives rise to marked hypertension. And so if patients are showing any features of that, then they should be investigated for this pheochromocytoma. This is done by checking urine levels of, I think it's one of the histidine compounds. Renal artery stenosis can occur in other cerebrovascular diseases. And the other thing is skeletal abnormalities. It's important to go looking for these because up to about 10% of patients with type 1 neurofibromatosis will have scoliosis. This is a curve of the spine. So it's important to pick this up early. Some patients with neurofibromatosis also can have macrocephaly, big heads, and hypertelorism. This is wide separation of the eyes. Sometimes if you've got neurofibromas with juvenile xanthogranuloma, then they're a greater risk of developing the myeloid leukemias, and this muscle tumor or rhabdomyosarcoma can also be seen. But note what I've said there, and there's few investigations you need to do for these patients. It's generally a clinical diagnosis on the basis of their 6 or more cafe au lait spots and their axillary freckling, perhaps with the Bleach Nodules, or there's a first-degree family relative who has neurofibromatosis. There are other rarer tumors such as optic gliomas that they can get as well. So it's generally a clinical diagnosis rather than one that has to be done with investigations. So Let's look at some other examples of this condition in global skin atlas. Actually, before I do that, I should go back and have a little talk about type 2 neurofibromatosis. Let's just go back to type 1 first. I said it's an autosomal dominant, 50% of cases new mutations, 6 or more cafe-au-lait spots and axillary freckling. The neurofibromas occur later in life, and lesions can form throughout life. And this is another important thing I should have mentioned. The severity of expression of the condition can vary between the generations. The other little thing that you can get with type 1 neurofibromatosis is it may only be in a certain segment of the skin, and that's called segmental neurofibromatosis. In other words, the neurofibromas only occur following, say, one of Blaschko's lines, perhaps on one side of the thoracic wall or on a limb. So remember segmental variants of this. This is mosaicism of cells within that dermatomal defect. In other words, the neurological defect is only in the cells that are in that line of Blaschko area. But what about type 2 neurofibromatosis? How does it differ? Well, type 1 is in 1 in 3,000 births. Type 2 is 1 in 40,000 births. And in these patients, they have a bilateral vestibular schwannomas. They can get deafness and tinnitus. And they can get balance problems, so they may present with that. They may have fewer than 6 cafe-au-lait spots, and often have 5 or fewer. And they don't show Crow's sign. They don't show that axillary freckling. And unfortunately, they may also get benign brain tumors called meningiomas. So the feature of type 2 neurofibromatosis is also inherited in autosomal dominant. It also has a high spontaneous mutation rate. But it's this bilateral vestibular nerve schwannomas that they get causing deafness, tinnitus, or balance problems. And they have fewer cafe-au-lait spots. I was going to show the other variants. This is from Global Skin Atlas, and many of these cases are courtesy of Dr. Namir Al-Sudani from Iraq. Let's look at this one first of all. This is a lady, unfortunately, as Namir says here, with neurofibromatosis in childhood, and look at the multiple lesions that this dear lady has on her face. He says there the face mimicked a bunch of grapes due to these tumors. He's also commented down that buttonhole sign that they're soft and could be pushed down into the panniculus by light pressure with the finger, and then spring back when it's released. Some of the others that we might see are, let's have a look at this one here. This is from Dr. Meravaran Merdat, and here he's showing an example of these cafe-au-lait spots, and in this particular image we're seeing an example of Crow's sign. This is the axillary freckling. And Merad has put down a variety of other facts here on neurofibromatosis type 1, most of which we've just gone over. Remember these plexiform neurofibromas, they are the ones more likely to undergo malignant change. They are the ones that are presenting as folds in the skin. If you ever see something like that, then there's a couple of other conditions that you have to consider, including the Proteus Syndrome. It can mimic it to some extent because it also shows neurofibromas as well. So remember the Proteus Syndrome. And a look at some of the others. Most of these are just examples of what in fact you've already seen. Again, you can see the varied presentation of these lesions. You can see the multiple lesions here, pedunculated neurofibromas here. And you can see just how covered the body can be with these when you inherit this condition and it's expressed in this particular fashion. So, neurofibromatosis, type 1 and type 2. a condition that it's important to establish for genetic reasons, that 50% are in fact spontaneous mutations. Note the cafe au lait spots. You can make that diagnosis or be suspicious of that diagnosis very early by examining a child and seeing 6 or more cafe au lait spots. And certainly if axillary freckling develops later on, or you know there's a family history within a relative of type 1 neurofibromatosis, you've virtually got that diagnosis made. And remember some of these rarer complications, including pheochromocytoma, that can occur with this tumor, and the potential for eye damage. These patients should all probably have an eye examination every year, because if a neurofibroma develops in the area of the optic nerve, the optic chiasma, then it can cause blindness. So it's important to have an eye examination with these patients done every year. It's well worth reading up about the condition. There's many other things that I'm sure I haven't covered. I've just tried to go over the major features that we see with this commonest of the autosomal dominant neurocutaneous syndromes. Thank you very much.